You're listening to All the Pieces, a podcast created to keep you informed. Now here's your host, Chief Quality Officer, Dr. Karan Mohan.
Hello and welcome to another episode of All the Pieces. I'm your host, Karan Mohan. Today, we're taking a break from the usual and going to introduce some very special volunteers that our caregivers and patients regularly interact with here at St. Joseph Medical Center. First, I'll let our human volunteers introduce themselves before we move on to our furry ones.
My name is Sharon Bannon, and this is my dog, Tao. He's a Shih Tzu. He's 7 years old, and he just loves being a Mosaic volunteer.
I bet. Shirley?
Okay, I am Shirley Breeze, and this is my dog, Autumn, who has turned her back right now. But anyway, she is a 9-year-old golden doodle, and she has been doing this since she was a year old. So
Wow.
she's a pretty good pro, but she absolutely loves doing it.
Excellent. So, and I know there's a special name for this program for the volunteer service. What is it?
The name is Happy Tales,
Happy Tales.
and it's a program that's been here at Mosaic, I understand, for over 20 years. We've been involved for about 3 years, and we just love it.
I bet. And so do the patients and the caregivers. And Shirley, how did Autumn get involved with Happy Tales?
Well, I was originally involved with the program with my golden retriever, Landry. He passed away a couple years ago. And I got Autumn when I still had him. And she started when she was a year old, and she's been doing it ever since. So
Excellent.
as soon as we get to the hospital, she is just wagging her tail. So it is a happy tail.
It's a happy tale indeed. And you said she started at 1. Is that right?
Well, yeah, they have to be at least 1 year old before they can be tested.
Okay. And is there special training or testing that goes along with this?
Well, there's through Pet Partners, there's a test that you have to take online, and that involves quite a few questions and answers, and you get a chance to pass a couple times.
Okay.
And then they have to know their basic commands, which is sit, stay, they cannot be any intimidation at all as far as if another dog walks into the room. And they have to just have a totally chill disposition, and you can tell that from Tao.
Tao is very chill. Tao's about to take a nap. Tell me more about Tao, and how did he get involved in this?
Well, I've had Tao since he was 2 months old, and I always knew that I wanted to be part of the program. Before the pandemic, I had a little Chihuahua that I wanted to get into the program. He was deaf, and the temperament just didn't work out.
Yeah, Chihuahuas tend to be a little spicy,
That's right. And so when I got Tao, the pandemic was just starting, and so that put a hold on just about everything. But I had all the paperwork and knew exactly what he needed to have to do to pass the test. And so we trained during the pandemic.
Very cool.
Then we've been involved for about 3 years.
Is it a written test?
It is a written test.
I was kind of joking about
for
that.
the handlers. They test the handlers.
Gotcha.
And we did have a written test, and then we were both evaluated during the evaluation part of it.
Excellent. And are hospital therapy dogs held to a different standard than, say, other therapy dogs?
We just have to be pass the tests
Gotcha.
that are involved with petpartners.org.
Okay.
And there are several organizations, but that seems to be the standard.
And what are their hours like usually? Is it 7 days a week? Is it 5 days a week? Or
We each kind of set our own schedule. We volunteer 1 day a week, and then special events on top of that. And we usually go to the main hospital, the surgery waiting area,
Right.
and then also visit some of the special staff that he's very fond of.
Yeah.
And then we go to the cancer center.
Of course. And Shirley, this is a question for you. What prompted you to get into this,
I have always wanted to do something like this, but I never had the dog that had the temperament to do it. And then when I got the golden retriever, he was mellow enough, I thought we'd give it a try. And we did, and he passed. And it's just something I can't do without it now because I love it so much.
Yeah, I can imagine.
She loves it. Autumn loves it. And if she didn't like it, then I wouldn't do it. But she
Yeah, that was
does.
my second question. Do you think they get the same joy as...
Oh, she absolutely does. We get ready to go, and she knows where we're going, and she will not leave my side because she wants to get in the car and come here.
This is their version of a park, I guess.
He gets excited when we pull in the parking
Yeah.
lot. He
Does he?
knows.
Do they get distracted on the job, so to say? If like a tennis ball came rolling by, would they just squirrel off?
I think she might look at it, but she won't go after it.
Okay.
Yeah.
Well, that's good to know, you know.
Yeah.
That's part of our training.
Yeah.
They distract the dogs
Okay.
Yeah.
and look at how they react.
So if I brought in like a whole bucket full of tennis balls in here right now...
They would. I don't think they'd do anything.
God.
They
I wish I
usually
would
drop
plan
a
that.
broom behind us.
Oh, okay.
Yeah.
Yeah, I was gonna. So if they get startled, they'll
noise.
start
Yeah,
barking.
no, if you're in the hallway and there's like a lot of carts going by and something falls, the dog doesn't react.
That's very good.
They might stop and look, but they won't
Yeah.
get scared and run away.
Startled or start showing
Right.
you the behaviors. Well, that's good to know because
Yeah.
they have to have a pretty even keel.
Right.
And how many dogs have been through this program overall, from your estimations?
Oh my gosh, I don't know. There's probably been around 20 of them all together through the years. I mean, they come and they go because the older they get, the more they need to retire. But
Sure.
there's maybe even more than that. I'm not really sure. They were started long before I got involved. So.
Yeah, 20 years is a long time, and I'm sure there's several cohorts of different
Yeah.
dogs, right? Any other expansion of this program to other centers, or is it just limited to St. Joseph so far?
Julie also does this in the Albany location
Okay.
because we went out there one time and we visited there.
And we've been to Maryville.
And what's the response been like across the system?
I
Every-
can't. Go ahead.
Everybody's just always excited to see him, and Mosaic has printed some calling cards for the dogs, and everybody wants to collect them. So everybody's real excited about getting our cards.
I've seen they have badges too. They have
Yes.
The
like
most fun thing is the badge. Everybody looks at the badge and they're like, they have their own badge.
yeah, they do. Do they get a 401k? No.
No. Sometimes I
we
wish.
wish?
But
Just unlimited
really.
compounding doggy treats, right?
yeah, really.
So let's going back on the prep work. You said there was this distractibility test and test for the handlers as well.
Right.
Are there periodic check-ins, or is it kind of like a one and done type of thing?
No, it's every 2 years.
Oh, really?
You have to go through the same evaluation, written test, and then the evaluation, the two of you together.
And it's got to be the pairs. It's
Yes.
not like
Yes.
somebody else can come in and be a handler.
Right.
Right.
Well, somebody else could come in and be a handler to my dog, but they have to go through the exact same process that I do in order to pass.
Excellent.
If they wanted to use my dog sometime for a visit.
Sure, that makes
That
sense.
would have to be up to me if I wanted to allow it.
And how has your life been enriched by this program and with Tao and Autumn?
Oh, I just love it. It's something that we both look forward to every week, and I especially like the special activities
Yeah.
that we participate in. We've traveled to some different locations in Maryville to participate in events, and we do a lot of holiday-themed activities. For Valentine's Day, we had a kissing booth set up at the Cancer Center, and everybody came out and enjoyed that. And,
Yeah.
and it was, I just love it.
Do they have different outfits that they wear for these?
Yes, they can wear some paraphernalia that, that is themed.
Yeah, I can see Tao's wearing a tie because this is a pretty serious event.
That's
for,
his Easter tie,
Yeah,
yes.
professional. I like it. Has it ever been in a situation where somebody does not want to interact with our furry volunteers?
Right.
And what happens then? And
Oh, as far as I'm concerned, I always ask, and I think we always ask, would you like to see the dog, or would you
Right.
like to say hello to whatever dog you have? And some people are just, no, I'm allergic.
Yeah.
And that's, fine. If somebody doesn't want to see the dog, there's no problem. We just move on to the next person.
yeah,
Before I get too close, I usually always say, "Do you like dogs?" And I can tell by their response, they say they're okay. Well, then I don't, I kind of
You don't push the therapy on them. You just
exactly. But when I get
No,
a big
you must
smile,
interact,
it's
right.
different.
I got it. That's amazing. And what's your split like between the volunteer service between patients and, say, caregivers? Because I, as a caregiver, get tremendous joy when I see Tao and Autumn in the hallways. Is it mostly for the caregivers? Is it mostly for the patient? Or is it just for everybody?
It's for everybody. We, of course, there are usually always caregivers where we go, and they're thrilled to see the dogs. They like to have their picture taken with the dogs, and I'd say it's almost half and half.
That's perfect. That's a good split.
Yeah.
And when is Autumn and Tao going to retire from this amazing service, or they're still mid-career?
Tao's mid-career. He's only 7.
Yeah.
And so I think we're in it for the long haul.
Yeah, that's good. I had a Shih Tzu growing up, and he passed away at 14. And that mid-career is, he's there.
He's there.
Right. What about Autumn?
Autumn is 9, and I'm hoping she can do it for a couple more years.
Right. Golden
But-
Doodle's a little bit less in age,
The larger the dog,
less amount of time.
less amount of time you have with them, which isn't nice. But
Yeah.
but anyway, but I hope to get another dog. I have 2 other dogs at home, but
They're not.
No,
They're
they're
not
not.
volunteer material.
no.
The broom falls behind them, and they're just.
Yes, they are not at all.
Well, that's good. At least you can recognize that.
Yeah.
Would you stick with Golden Doodles, or would you branch out to some other breeds?
I would branch out to anything that, I felt. I love the Golden Doodle breed. I
Oh, they're
really do.
amazing.
But, I like the Bernedoodles, and I'm a doodle person. I just like the
I'm looking at a
doodles.
mini Bernedoodle as a next family member, but we'll see how that goes.
Yeah.
It's just a fantasy right now.
But
So
they're good.
Well, thank you so much, Shirley and Sharon, and obviously Tao and Autumn for being a part of this podcast today. Any final words or message you want to get out there to our audience?
We have 7 dogs in the program, and I would encourage anyone who's interested to contact Julie Case and get some information and see if you might like to join us.
In an ideal world, I would love every furry volunteer in every floor unit all the time.
Yeah, the one thing is there are so many thank yous that you get.
Yeah.
And there's so much appreciation from caregivers and from the patients and from, you go to the waiting room or the emergency room and they're having a really bad day and you walk in with that dog and they just say, oh, we really needed this today.
It is a furry Xanax.
And it is. It's just a fantastic feeling to know that you're really helping out.
Yeah, and I truly believe that their presence alone just brings down the tempo of the entire place in a good way. So thank you for your volunteering service. Thank you to Tao and Autumn again. And if you have any information that you're seeking as an audience member, please reach out to Julie Case, and they can get you a lot of information about our furry animals and friends here.
Great.
Until next time, folks, take care, brush your hair.